Okay. So this is a limb salvage case that we decided to present here today. This patient was encountered and his hospital course was at Queens Hospital Center. The team that took this over was Dr. Axman, our other attendings, Dr. Bricia and Dr. Zhang. And then myself and Lauren was involved, and then our new resident, Jean, was also involved in the late stages. We chose this patient to present here today because during my residency period, I'm a third year now, I believe this is this was the best representation of a limb salvage case that I experienced. There were many others, but we just decided to select this one and highlight this today because we feel strongly about that. And I also feel that I will remember this patient and this limb salvage case here even after residency and look to this as for inspiration mainly on preserving limbs and what all it requires. It requires the whole hospital, essentially, many departments, and we all work together to get it to where we are. So we'll start. This is a 55-year-old male with diabetes, uncontrolled, hypertension and hyperlipidemia. He presented with left foot pain to the emergency from a work site injury. He stepped on a nail through the work boot, and on the initial encounter, the emergency room managed the patient. They saw and they gave the patient antibiotics and gave him a referral to come see us in podiatry. But the patient, I'm not sure what that history in between was. He wasn't really clear about that, but not sure if he was complying with the antibiotics, but obviously the foot worsened, the infection worsened, and he presented this to us like this in this stage here. And the lab showed a 25 white count. He was in DKA and very hemodynamically unstable. On initial encounter, after evaluation and speaking to anesthesia, he was deemed not stable enough for operating room debridement, so we proceeded to do a bedside debridement. And after a couple of days, we monitored, and this is how the foot looked at that point. This is post-op debridement day 2 or 3, approximately, and so we brought in general surgery and vascular to evaluate and take a look and give their inputs, and they pretty much deemed the foot non-salvageable. They said, we don't believe that this limb will survive. We can discuss with the patient his options. The patient was not interested in a baloney amputation, and after discussion and upon patient's request, podiatry was asked to take a leading role in the salvage procedures. And so then we also asked general surgery to come assist us with a very extensive debridement that went beyond the ankle, above the ankle, just to remove as much dead and non-viable tissue as possible, just to get a clean slate to start working with. So this was post-op, that extensive debridement, and this patient also additionally went through multiple serial debridements and applications of many different grafts, and we were able to get it to where the extensor tendons were completely covered, the wound was improving, but just because of the sheer size of the wound, we wanted to refer the patient to plastics for evaluation of a split thickness skin graft, and they had their cutoff of A1C of 8 for what they deemed to be that it will heal or will not heal. Unfortunately, the patient happened to be just above that, so they did not accept the patient as a surgical candidate. However, the one positive outcome of the plastics referral ended up being that the patient was referred to hyperbarics. One of the things that complicated the patient's situation, whether it be in the hospital course or in the clinic course, was the fact that he was undocumented and uninsured. So that provided a lot of barriers for us throughout the whole course. So plastics managed to get the patient hyperbarics treatment at one of their outpatient facilities, which is part of the HHC system. And as you can see, from here to down here to now, this is the most recent picture. This was around mid-August, early August. His wounds have shrunk down and reduced significantly to just minor residual wounds that are fully granular and still closing. And I believe as of most recently, he should be pretty much healed. And, you know, there's a lot of details that is not in this abstract right here, but the reason I presented in this format today is because we do plan on submitting this for a full article at a limb salvage type publisher. And yeah, this will be evolved into a full case presentation that we intend to submit. If there's any questions or anything you guys want to add, please feel free to do so.